Okay, well, thanks, Alex. I really appreciate the invitation to be here. Thanks to the MedStarter team for putting on a terrific conference. So I'm going to talk to you today about how not to raise your Series A. It's intended to be a little edgy and a little provocative, so we're going to jump into that in a minute. My name is Adam Dakin. I'm the Managing Director for Dreamit Health. Dreamit's an accelerator, and to table set, tell you a little bit about Dreamit. But first, how many of you actually ever heard of Dreamit? I'm curious. Maybe half, so our branding and marketing has a little work to do. Also, I got to tell you, after fart, I'm feeling a little underdressed. I'm not going to lie. So let me table set by telling you a little bit about Dreamit, because we're really not your typical accelerator. So dispense with your perceptions of accelerators, because our model is very different. Okay? We are a venture-backed accelerator, which means that we co-invest in the companies that we accelerate. We're hyper-selective. We accept less than 5% of the programs that apply to Dreamit every year. We accelerate about 20 companies in the health vertical. You can see from the slide we have several different verticals that we apply the same model to. We've been on the health vertical, which I lead, we're about 3/4 digital and about 1/4 med tech, med device. We've been doing this for about 9 years. We've accelerated over 300 companies, over 90 in the health vertical. And the KPI by which we judge ourselves is the percentage of companies that complete a raise within 6 months of completing Dreamit. That's really important for us because we get returns by co-investing in those companies. And actually in our last health cohort, that finished about 4 months ago, 6 out of 8 of the companies within that 4-month period have actually either raised or gotten term sheets. So we think that's a pretty good number when you compare it to traditional accelerators. And what you see up on the slide here are the logos of several of the companies that we have accelerated that have gone on to scale and raise capital. Our next cohort is the spring of 2018 cohort, and if you want to learn more about Dreamit or you want to apply to be in the cohort, please go to dreamit.com/health. So let's jump into the topic. So a little bit of backstory here. How did I come up with this topic? I've actually attended over 150 investor conferences in my career, and at lots of those conferences, there's a session that's loosely described something like what venture capitalists look for when investing in startups. Okay? We have all heard this so many times. Like, how many times are you going to hear about the big market that the venture guy wants, the big problem you're solving? Got to have some traction. Better have a great team. Okay, it's true. It's all cliche, but it's true. Okay, I'm going to tell you, if I have to sit through another one of those panel discussions, I would rather stick sharp needles in my eyes. I think when you go into that discussion, most audiences go into a coma. Okay, hence the coma reference in the background. Not sure how well that's coming across. I mean, I don't really think anybody wants to hear that discussion over again. What I think is more interesting, and now that I've sort of moved, I've been with Dreamit 4 months, I'm an operating guy. I've co-founded 5 companies. I'm not going to lie, still having trouble thinking of myself as a venture guy. Okay? But now that I've moved to the other side of the table, I'm getting some visibility on some sort of common mistakes, errors, self-inflicted wounds, if you will, that prevent companies from raising their Series A. And I thought it'd be a little bit more interesting to talk about some of those, because most of these are completely avoidable, yet they will compromise your ability to fundraise. So up on the screen now, some of you may recognize this if you saw the movie Wall Street. Okay, there's a scene in Wall Street where Bud Fox, who's a young stockbroker, has worked for months to get a meeting with Gordon Gekko. Gordon Gekko is a billionaire Wall Street raider, right? And Bud, he finally gets that meeting. He's about to walk into Gordon Gekko's office. So he stops in front of the mirror, he straightens up his tie, he looks himself in the eye and he goes, life comes down to a few moments, and this is one of them. Okay? Well, if you're an entrepreneur and you're ready to Series A, you have worked your tail off to get to that point. Your team, you've made sacrifices. Your team has worked hard. You've taken money from your friends and your family, right? But great, you have finally gotten to the point where you are ready to scale and professional investors want to talk to you. So when you're walking into that professional investor's office, for you, life comes down to a few moments, and for you, this is one of them. But here's the thing. right? Despite the pleasantries and the friendly admins, you are walking into a hostile environment, okay? Venture capitalists say no to over 95% of the deals that they look at, okay? They're looking for reasons to say no, all right? In the movie Wall Street, when Bud Fox walks into Gordon Gekko's office, Gordon gets up on the table, he leans forward, he looks him in the eye, and he said, "You had what it takes to get into my office, but do you have what it takes to stay here?" The venture capitalists aren't saying that to your face, but that is exactly what they're thinking when you walk into their office. So first, one of the very common mistakes, unprepared for the meeting. What do I mean by that? Let's drill down a little bit, because it's not as obvious as it sounds. Unprepared means two things. One, have you rehearsed your pitch over and over so it's smooth, it's a great story, it flows? What I suggest, first rehearse in front of your friends, your family, colleagues. Ask for honest, critical feedback. Once you've done that, go pitch venture funds that you know will never invest in you. It seems like a waste of time, right? No, it's not. Think of that as your off-Broadway play, right? You don't take your first play to Broadway. You go off-Broadway first. You practice. You rehearse some more. You perfect. Once you think it's cohesive, then you go to the high-value targets. Then you go to the venture funds who are likely and where you think you're a fit, okay? Second, research. When you go to a venture fund, you should know the details of that venture fund. You should know what their portfolio consists of. You should know their investment profile, what stage they invest in. You should know something about the backgrounds of the partners, who's likely to be your champion for the deal, right? And you should be able to answer two important questions. Number one, why are you a fit for their fund? Number two, how can they be a value-added investor in your company? The second common mistake is what I call the 5-minute flight pre-check. Most venture capitalists are making a decision if you are an investable team within 5 minutes of shaking your hand, right? We have a subconscious checklist that we're running through in the back of our mind after we meet you. And basically what we're asking ourselves is, does this team have the right stuff? Do they have the right personal characteristics, the grit, the tenacity, things that in our mind great entrepreneurs have, right? That sort of the power of subconscious thinking is described in a great book by Malcolm Gladwell. It's called Blink. If you haven't read it, great book, suggest that you do. But here's my suggestion on how you solve that. Start without the deck. Entrepreneurs come in, you're excited to get started, you know you're under time constraints, you want to get right into the deck and tell your story. Don't do that. Stop, pause, tell your story first. Tell your elevator pitch, right? We started this company because, and usually there's a personal connection. We started because my brother had this problem, my mother had an issue, right? Make that personal connection. And if you tell that story in the right way, it will reveal those characteristics. It will reveal your passion, your energy, your drive, your motivation, right? And you can have that all come out in a 5-minute story about why you started your company. Another common mistake, what I call death by PowerPoint, okay? Venture capitalists listen to hundreds of presentations a year, okay? Make your story interesting. Investors, venture capitalists have very short attention spans, right? So, but what do all venture capitalists have in common? They all want to make money, right? And they all want to make money by solving big problems. So very early on, once you jump into that deck, you've told your story, you've made the personal connection, now your deck is up. Very early in that presentation, establish the big and urgent problem that you're solving. But do it with evidence. At Dreamit, we call it the hand wave. We have lots of entrepreneurs who come in and they go, every doctor's going to want one. It's like, well, why? Do you have evidence that every doctor's going to want one? I want to hear an answer that's like, oh, and by the way, we talked to 25 doctors, and this is the problem, and they told us they wanted this solution. Or, better yet, we actually have traction. This is in 5 hospitals, and they're using it, and the feedback's been positive. And then finally, nail the value prop, right? Describe the solution in a way that's clear, concise, understandable. My suggestion, start with an interesting and compelling use case, right? And make it personal. So for example, if you're a chronic disease company, start with the story about Aunt Mary. Aunt Mary has heart failure. She's been hospitalized 3 times over the last 4 months, right? Oh, and here is Adele. Adele is Aunt Mary's care manager. Adele is managing 1,100 patients. She's stressed out. She's overworked. She's not delivering the quality of care she thinks she's capable of, okay? Now, take me through the story, the before and the after. That was before your solution. Now, with your solution, how do we prevent those readmissions? How did we make life better for Adele? Oh, how did we save money for the payers? Touching on all the stakeholders, but at a level that's very personal, right? Because we all have parents and grandparents, and we all want to personally connect with the solution. Finally, another self-inflicted wound. You've gotten through your Series A presentations. You've had a bunch of meetings with the venture funds. Great. The phone call you've been waiting for. We would like to start due diligence. Excellent. Congratulations. Don't be this guy when the investor due diligence list arrives. We know what's going to be in that list. You should know they're going to expect to see your financials. They're going to expect your budget, your financial projections, your cap table. They're going to want to see your market model, right? They're going to want to talk to customers if you have them. So put this stuff together. Make sure it's accurate and up to date before you start soliciting Series A investors, right? The time to clean the house is not when the guests are standing at the front door, okay? These things have a cadence, and we expect you to respond quickly and promptly to our due diligence requests. One solution, one suggestion, create and populate an online due diligence vault in advance, right? And use good naming conventions. Make it easy for the investor to find the documents they want when they go into that due diligence vault. So let me close by saying, it's really a good time to be raising, particularly if you're in the digital health space. This is some data from Rock Health. And 2017 will be the biggest year on record for digital health fundraising. In 2016, I apologize, I know this slide is a little bit hard to see, but about $4.4 billion went into digital health in 2016. That'll hit over $5 billion in 2017. There were something like 320 deals done in 2016. That'll be over 400 deals in 2017. So it's a good time to be raising money in the digital health space, but fundraising, think of it like interviewing for a job, right? The job typically goes not to the best candidate, it goes to the person who interviews the best. And the same is true for fundraising, right? The money doesn't always go to the best companies. It goes to the companies that are the best fundraisers. So with that, I will wish you the very best in your fundraising endeavors. If you're interested in the Dreamit program, please go to Dreamit.com, and I look forward to meeting you and telling you more about Dreamit during the conference. Thanks for your attention.
That's awesome. It's really good. Thanks. So great, Adam. That was really, really great information. Appreciate all that advice, and definitely listen to him. He knows what he's talking about. And it's very important to have great advisors and to have good accelerator behind you. Of that 4.4 billion, 866 of it happened here in New York in 2016. So it's not just a great time, it's a great place. Also in this room, I mean, I've heard from a couple of investors here, and there are a lot of investors here today, that they are going to invest in some of the companies they've seen today. So that's very exciting, and they want to do deals with them, and this is that place, okay? Always be on, always be ready. How many people actually have a MedSoda crowdfunding campaign that they've done in the past or they're doing one now? Okay, and in there you have your deal room where you can actually organize all those documents and things like that, where only the people that you want to get to it can get to it. So, so yeah, we've been creating that ecosystem for you guys, with you guys, and we're very excited about what we see happening all the time there.